Mr. President, the holiday rush is underway, and millions of Americans are decorating, shopping, and preparing to spend Christmas, Hanukkah, and Kwanzaa with their loved ones. I want to draw attention to one woman from Illinois who is doing something very different. Janet Teasley. She's a registered nurse in Chicago. She has volunteered to spend her holiday season in Liberia, treating patients with the potentially deadly Ebola virus. When Janet Teasley first told her family and co-workers of her plan, she says she encountered some resistance. One doctor with whom she works was only half kidding when he said he thought she was crazy. But once he realized she was serious, the doctor told Teasley he admired her. I share that admiration. The United States Agency for International Development estimates that nearly 16,000 people have contracted the Ebola virus. Nearly 6,000 have died. Today, it's estimated that 7,000 people in Liberia, where Janet Teasley is volunteering, have Ebola. She's helping some of the neediest patients in that country that's been the hardest hit by this disease. Although Ebola has been contained so far here in the United States, the outbreak is still raging in parts of West Africa. Teasley is part of a wave of U.S. healthcare workers being recruited to help stop the spread of the disease in Liberia, Sierra Leone, Guinea, and now Mali. Teasley got involved through America Cares, which is one of about 150 nonprofits working with our government to recruit workers nationwide. Teasley's been a nurse for 17 years, working in emergency care and infectious disease units, most recently at Holy Cross Hospital in Chicago, a hospital which I know well in the inner city, which serves some of the poorest families in our town. Now she's going to spend 8 weeks in Buchanan, Liberia, training and then treating the patients. She explains, quote, "I came here for a purpose. I want to see it through. I honestly believe no man is an island. Each man's death diminishes me. That's why I became a nurse," end of quote. Teasley's daughter, Danica Miller, wasn't surprised by her mom. She says for leisure, her mom doesn't read novels, but pores over books about infectious diseases. Despite her family's support, Teasley is conscious of the increased risk she faces. In fact, many of those who've fallen ill have been healthcare workers themselves. Teasley is just sure she's not going to be one of them. She said she's confident in herself and her team, and she'll be able to come home safely. To stop this epidemic, we need many things. First and foremost, we need more people like Nurse Teasley. The federal government is seeking medical professionals to work in the 23 Ebola treatment units being established in Liberia. While the number of volunteers increased steadily this fall, it didn't drop off a bit when there was confusion over quarantine policies for returning medical workers. With time and perspective, that confusion seems to be settling. Illinois has brought its quarantine policy in line with the Centers for Disease Control. With a scientifically grounded and carefully measured approach, the hope is that healthcare workers with the same passion, dedication, and courage as Nurse Janet Teasley will volunteer to help those in need. I met with Tom Frieden, director of the CDC, a couple weeks ago. He and the members of the international public health community maintain the way to control spread of Ebola is to contain the virus at its source. To prepare for the possibility of Ebola patients here in America and to help with containment overseas, the Obama administration has requested $6.18 billion in emergency funding, including $1.83 billion for the CDC. I support the president. Janet Teasley is a valuable and commendable part of this effort. I hope people will hear her story and the stories of people like her and support the United States efforts in Liberia. Mr. President, I yield the floor.